So let me just. Okay, wonderful. All right. So first of all, can you hear? And first of all, if you could mute your mics as well so that we don't disrupt the speakers. So again, I'll just introduce myself again. So good afternoon, everyone. My name is Abby Beho. I am the Program Director at Lake Health and Wellbeing. We are a public health NGO based in St. Kitts, and we aim to improve the health and well-being of our local, regional, and online communities. So today's session is a collaboration between the Media Association, the Behavioural Health and Wellness Center in Nevis, the Taiwan ICDF, and Lake Health and Wellbeing. And the aim of this session really is to provide journalists with information about mental health and well-being as a bit of an introduction to assist you in your reporting as you report on various different issues related to mental health. But we also wanted to give you a few tips on managing your own mental health, because we know that the life of a journalist can be very stressful. So we also wanted to give you all a few tips on how to manage your own mental health. So we're going to have two guest speakers for you today, Mr. Cuffy and Mrs. Shih. And they will talk you through some mental health issues, what's going on in St. Kitts and Nevis, introduce you to the project that's ongoing with the Ministry of Health. And then we'll have questions at the end. So you can save all of your questions to the end. You can either at the end put your questions in the chat, or you can unmute yourself and ask your question. So before we get started, I'm going to ask Andre from the Media Association just to provide some remarks. So over to you, Andre.
Hi, Abby. Thank you very much. Thanks. Good afternoon to everyone in the call, the webinar this afternoon. On behalf of the Media Association of St. Kitts and Nevis and the executive and the entire membership, I'd like to express my profound thanks to Lake Health and Wellbeing, as well as the partners that are have collaborated in making this webinar possible, and for seeing the importance and the need of having this kind of initiative for media workers and journalists. And as you pointed out, Abby, in your opening remarks, that you know, this job can be stressful, and if we don't have to look further than what has happened in Jamaica recently, just this past week with Hurricane Melissa devastating parts of the island. The journalists who are on the front lines in Jamaica covering that disaster, you know, are certainly right now faced with a huge challenge, not just in terms of covering the actual story, but just mentally dealing with and coping with that. Thankfully, we're not experiencing that right now in St. Kitts and Nevis and in the Eastern Caribbean. But there are other aspects of our work that does require or does demand, it can be demanded and can be quite stressful. So our hearts, while we're here, our hearts do go out to the people of Jamaica, and especially those journalists on the front lines. And so it is important for us to have this kind of initiative, this kind of training that will help journalists and media workers bolster themselves and prepare themselves to deal with aspects of mental health that we're confronted with on a day-to-day basis. So we're very elated to have this opportunity. We've also extended the invitation to some of our colleagues across the Caribbean in the OACS and in other parts of the Caribbean. And hopefully we'll see some of them joining us. I think some have already come on, and hopefully we'll have some more coming on later. So again, we want to thank all the partners involved in making this possible. And we look forward to a continued relationship with Lake Health and Wellbeing. This is our second initiative, second webinar of its kind. We've had one early this year, which was also, in my opinion, has been quite successful. So we're certainly looking forward to more collaborations in the coming months and years as we continue to work together in helping to equip our journalists and media workers in St. Kitts and Nevis. So again, thank you.
Wonderful. Thank you so much for your very kind remarks. We really appreciate it. And we do appreciate that journalists are on the front line of a lot of really tragic and emotionally draining issues and events. And so we just hope this webinar will help in that regard, as well as also equipping you to address and report on mental health issues. So thank you so much for your remarks. So I'm now going to introduce our first speaker, and this is Mrs. Ivy Shih. Sorry, Ivy, I hope I had said your surname correctly, but over Ivy. So just to tell you a little bit about Ivy. So Ivy is a nursing professional with extensive experience in managing international health projects under the Taiwan ICDF. She currently serves as the project manager for the Mental Health Services System Enhancement Project in St. Kitts and Nevis. Her previous roles under the Taiwan ICDF include NCD Project Manager in Kiribati, Maternal and Infant Health Project Manager in Eswatini, and project officer at the ICDF headquarters. So she's very experienced. And so we're going to hand over to Ivy so she could tell you a little bit more about the wider mental health project in St. Kitts and Nevis. So over to you, Ivy.
Thank you, Abby. Good afternoon, everyone. It is a great pleasure to be here with you today. My name is Ivy. Thank you, Abby. You're trying to pronounce my surname. It is Ivy Shih, so you can try that next time, Ivy Shih. And I'm the project manager of the Mental Health Service System Enhancement Project. Firstly, I would like to thank Lake Health and Wellbeing to organize this meaningful session. It's a great honor for me to meet all of you here. Let me take a moment to briefly introduce this Taiwan ICDF project, which is a collaboration between the Taiwan ICDF and the Ministry of Health. This 3-year project began in 2024 and will continue until August 2027. And our goal is to strengthen the national mental health system to promote greater community awareness and access to care. And this project, it includes 4 key components. Firstly, it's policy support. So we conduct community mental health screenings and prepare data and statistical reports for the Ministry of Health, and helping policymakers make informed decisions based on real evidence. Secondly, we do capacity building. So we train health workers to improve their skills in diagnosis, treatment, and care of mental health conditions. And thirdly, community awareness. So we promote the message that mental health is just as important as physical health, and that no one should be afraid or ashamed to seek for help. And finally, strengthen health facilities. So we provide occupational therapy equipment and supplies to support rehabilitation activities, helping patients in their recovery journey. There's an important part of this project is to ensure local sustainability. So we have identified 6 sitting instructors who received intensive training in Taiwan and are now conducting the training sessions for local healthcare workers. So today's speaker, Mr. McMillan Cuffy, despite his many responsibilities, he's also one of our sitting instructors. And we are here according to, the reason why we are here is because according to PAHO, that across the Caribbean region, mental disorders is remain among the top causes of health burden. And here in St. Kitts and Nevis, according to our screening data, it shows that young people under the age of 19 often report higher level of stress than adults. And so to respond to this, we also provide the training for school guidance counselors and educators so that they can better support students who may be struggling. We are also working with Lake Health and Wellbeing to create an online simulation game for students. And this game, it will help young people recognize signs of stress early and learn practical coping skills to manage their emotion in healthy ways. That is much of what we are doing right now. And for you as journalists, you have an incredible influence on how people understand and talk about mental health. You can shape public attitude, challenge the stigma, and encourage those who are struggling to reach out for help. So, and also as just importantly, your own mental health are also important. So I truly look forward to today's webinar, which will explore both responsible reporting and personal well-being. So thank you very much.
Wonderful. Thank you so much, Ivy, for your remarks and very clearly outlining the Mental Health Service System Enhancement Project in St. Kitts and Nevis. So thank you so much. So after Mr. McMillan's presentation, if you have questions for Ivy, then you can ask Ivy any questions that you may have. So I'm gonna now hand over to Mr. McMillan Cuffy. But before I do that, I just want to tell you who he is. So Mr. Cuffy is a mental health professional with over 25 years experience. At present, he is a mental health counselor and supervisor at the Behavioural Health and Wellness Center in Nevis. Mr. Cuffy is also the project coordinator and a seed instructor for the Mental Health Service System Enhancement Project for Nevis. Previously, he worked as a mental health counselor at Ross University School of Medicine and the government of the Commonwealth of Dominica. So we have a very professional and experienced mental health professional for you today. So over to you, Mr. Cuffy, and thank you so much.
Okay, thank you very much, Abby. Can you all hear me okay?
Yes, we can hear you.
Great, great. A pleasant good afternoon to everybody, all the journalists and the management team that were able to collaborate with Lake Health and ourselves to put this this webinar together. It's my pleasure being here. I think the topic is very timely, you know, and it shows that I want to commend really the leadership team of the Media Association to put this webinar together. It shows that you do believe that mental health does have its place and the importance in the work that you do. As Andre said, you know, the job that you do is very stressful, and you experience a lot of trauma while doing the work, while you execute your functions. And so putting on such a webinar is a fantastic idea, and hats off to you. Congratulations. Well done. Having said that, let's get into the task at hand. So I want to start with this quote. Our work as journalists on mental health, stigma, and discrimination is very sensitive because it shapes public reception and attitudes. Journalism transmits ways of thinking and viewing the world, influencing beliefs and opinions. Therefore, responsible reporting can reduce mental health stigma by promoting empathy. However, it can also cause harm if not handled carefully. And that's by Ben Adams, who is a mental health specialist with the World Health Organization. I felt that this quote was very timely because it captures the power and the dual responsibility of the media, the ability to be a force for good in promoting understanding and reducing stigma, or conversely, a cause of harm through careless or sensationalized coverage. I think that sets the tone for our presentation this afternoon. I would like to continue by just going with a definition of what mental health really is. So it refers to a person's emotional and psychological and social well-being. It affects how individuals think, feel, and behave, as well as how they handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood through adulthood. So it covers the entire lifespan of development. Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, and learn well, and work well, and contribute to their community. And this is the definition by the World Health Organization. All right. Good mental health is more than just the absence of mental illness. It involves the presence of positive characteristics, such as the ability to manage emotions, maintain relationships, and adapt to change or uncertainty. Having said that, we need to also look at then what is mental illness. And that refers to the diagnosable conditions that affect a person's thinking, a person's emotional state, behavior, and functioning. These conditions cause significant distress and impair a person's ability to cope with daily life, their work, or relationships. So, according to the American Psychiatric Association, mental illnesses are health conditions involving changes in emotions, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and/or problems functioning in social, work, or family activities. So now that we have looked at the definition of mental health and we have looked at the definition of mental illness, then let's continue to, I'm going to just give you some stats. This is specific to Nevis from 2015 to 2022. However, I do not believe that this is very much different from the stats, say, in St. Kitts. So I think that is a very close a close representation of the mental health situation in the Federation. If you look at this graph, we have personality disorders, neurocognitive disorders, substance-related and addictive disorders, disruptive and impulse control and conduct disorders, sleep-wake disorders, somatic symptoms and related disorders, trauma and stressor-related disorders. We have neurodevelopmental disorders, schizophrenia spectrum and other disorders, bipolar and related disorders, depressive disorders, and anxiety disorders. These are the majority of the cases that we see in Nevis. As I said, that was between 2015 and 2022. Now, our next slide, what's happening there? Okay, I'm trying to move my slide. Oh, what's going on? Look like I'm frozen. Okay, hold on. I got it. All right, good. Okay, the next slide. The most common mental disorders in Nevis are the addictive disorders, schizophrenia, and so we have the mood disorders. So we have substance use, schizophrenia, and the mood disorders, which include the depression, anxiety, and even bipolar disorder. So if you look at the substance use disorders, would be the leading next to schizophrenia and the depressive disorders from the graph. We have trauma and stressors, or trauma and the related disorders and anxiety disorders. These will form the most common disorders between that prevalence study that we looked at between 2015 and 2022. All right. That is just basically what I just mentioned. But to give you a little more context, the ages of 20 to 29 is the group with the highest diagnosed mental health disorder that we saw during that period. There is an increasing trend of diagnosed patients from 2015 to 2022 when we did a study, and males have a higher occurrence of substance abuse, schizophrenia, and the neurodevelopmental disorders. Females, on the other hand, had more of the depression, post-traumatic stress disorders, the anxiety, and the neurocognitive disorders. All right, so that's just to give you a little context in terms of the mental health situation on the Federation of St. Kitts and Nevis. All right, so in terms of the media and mental health, all right, it's important that persons working, like the journalists, are able to share their lived experiences. All right. Personal stories shared through various media can normalize mental health challenges and demonstrate that recovery is possible, which is crucial for reducing self-stigma. As we know, mental health is very highly stigmatized. As a result, people, even though the services on the Federation through the government services are basically free, people do not access the services that are made available to them because, they don't want persons seeing them accessing these buildings where the services are provided. All right. So the media plays a very important role in helping to educate persons and reducing the stigma surrounding mental health issues or mental health. Awareness and education. Responsible media coverage can increase public awareness about mental health issues, reducing shame and encouraging help-seeking behavior. Accurate news reports and well-written articles can educate the public. And the connection and community, social media can create supportive online communities, especially for those with stigmatized conditions or those who are geographically isolated. And one group that, is usually singled out here is the sexual minorities. All right. And the media can also help in facilitating peer connection and access to social support through social media. So let us look at some guidelines for responsible media reporting. In order to minimize harm and maximize positive impact, you want to consult with the experts. You want to consult with the experts. You want to ensure that the information that you're putting out there is in fact factual. It is factual. Do some fact finding. It's easy for us to run with information without fact checking and ensuring that what we're putting out there is accurate. And not just accurate, but we're checking with the experts. They can help you to structure the information that you're trying to put out there so that when it goes out to the public, that it is you're using the proper jargon, the proper language to bring out the story that you want to really put out there. Include perspectives from mental health professionals and people with lived experience, those who have personally dealt with mental health conditions. Now, again, the caveat there would be that could be a challenge in that persons with lived experiences may not necessarily want to come forward because they don't put their face to, to their stories. But I'm sure you as media professionals, you can bring on the story without revealing the identity of the individuals given their lived experience. And so, there, I believe with responsible reporting, we can still do that. Focus on the whole person. Highlight the individual's life and achievements, not just their illness, to promote a more balanced and humanized view. It's easy for us to get carried away, and probably just try to look at the issues that may come across as somewhat negative, because of what is happening in the moment. But outside of any specific incident or event regarding that individual at that time, the person has a life other than just that specific incident or event. And so how can we highlight the person's achievements and the positive aspects of that person rather than just the illness or whatever is going on that can be perceived in a negative way when we report the event or the incident. Let's look at some ethical issues. we want to be sensitive and we want to report accurately. We want to use the language, we want to use the accurate language and be sensitive to the stories that we are putting out there. So one way you want to do that is that you want to employ people first language. Example, a person with schizophrenia, instead of saying is schizophrenic. Because by doing that now, you are labeling the individual as opposed to say a person with schizophrenia. And of course, you want to avoid the derogatory or stigmatizing terms like crazy, insane, para, and whatever else local panels that we use. You know, so you want to use accurate language and report in a professional manner. Report on suicide safely. That's a big thing. You want to avoid explicit details about the method, the location, and always include crisis hotlines and resources. Again, you want to be very mindful of identifying information. The media, you guys are powerful. You all have a lot of power in that. Sometimes the story gets out there to loved ones and significant others by the work that you do. Now imagine someone who's lost a loved one by suicide, turns on whatever media device and see that or learn through social media or whatever other form that their loved one has passed by suicide. Just imagine the trauma that that person can experience getting that information in that manner. All right. So knowing that or being aware of that and being sensitive to that, it's important that you be very careful and mindful of the information you put out as relating to suicide. All right. Mental health on a whole period. Now, we want to avoid the sensationalism. I think sensationalism comes with the profession. People love a good story. People love a excited story, an exciting story. But, you know, I believe to be responsible reporters, responsible media personnel and journalists, sometimes, especially when it comes to mental health, suicide and these issues here, sensationalism cannot be the primary goal of reporting. You do not want to sensationalize or overly simplify mental illness, especially when reporting on acts of violence, as this reinforces harmful prejudices. And so we have to be very careful as to how we handle these sensitive reporting. So what are some of the challenges? Positive and accurate portrayals can directly reduce the stigma associated with mental illness. Yeah. Again, I spoke about stigma earlier on, and I'm sure with your experience as media personnel, you know that you guys are like influencers. You can influence persons' perception of a lot of issues that you report on. And so the way you report on it can either do harm or do good. And I'm sure as responsible journalists, you really want to be very mindful that you reduce harm and rather do good. You want to do greater good rather than greater harm. And so by reducing stigma as much as possible in the work that you do is what's crucial. By featuring diverse, well-rounded individuals with lived experience, the media can humanize conditions and show that mental health challenges are common and treatable. And they are. All right. We want to be more human in the way that we do our reporting. You know, always remember, that every story that involves a person, we have to be considerate of that individual or the people that we're reporting on. Originally a human. And so basically it's like empathy, like a lot of what we do in our work is put yourself in that person's shoes. How would you like to be treated if it were you? And if you're going to report on sensitive issues, how would you like that? How would you have liked the media to have to report on your condition or your situation? And so just basic golden rule, do unto others as you'd like them to do unto you, is very applicable here. In terms of awareness and education, the media has a very big role, huge, in promoting awareness and education, as you guys are doing. You guys do a great job in awareness and educating the public in a lot of different aspects of life and what's going on around us. Okay, but the media can educate the public on different mental health conditions, symptoms, available treatments, and preventative strategies for overall well-being. The media can provide education and awareness in terms of providing clear, accessible, and verified information about where to find support, such as hotlines, local services, and online resources. And later on in the presentation, I will show you a couple slides of some of our local resources that, this has been recorded. I'm sure Abby will share that with you guys. And so you can have that so you could make it available to the public. You can also use social platforms. This thing is in my way. In particularly, space for open discussions, peer support, and the sharing of personal stories, thus normalizing the conversation around mental health. All right. Personal stories, yes, but again, when we're doing that, of course, we want to ensure we have the permission of the individuals. All right. And just normalizing that conversation, because if we dehumanize it and we report in such a way that is so heavily stigmatized, then we lose our audience. We lose the what is it that we're trying to accomplish. Yeah. So again, when we use the platforms, we want to be responsible in terms of how we do that, the information we put out, and ensuring that we take in consideration of persons' privacy, confidentiality, and all of that. You can actively correct widespread misinformation and stereotypes about mental illness, like the myths that people with mental illness are always violent. That is not true. Persons with mental illness they are not always violent. As a matter of fact, there are a lot of persons with mental health conditions that work and go about the normal day business like all of us. But because those persons are adhering to their treatment plan, and they're stable, we don't know. We are only seeing that aggressiveness and the violence when these persons have decompensated to a point where, yes, they can be combative, yes, they can be violent, yes, they can be aggressive. But really and truly, that's the minority. That's not the majority of persons with mental illness. And so that's why I said earlier on in the presentation that it's important to consult with the experts. Get the facts, do your fact finding. All right, do your fact checking. For some reason, my screen is okay. It sticks sometimes, I know why. All right. Distress, there's another quote I would like to put out there, because it takes us into another part of this, another aspect of that presentation, talking about self-care and all of that. So I wanted to start this section with this quote: distress in the face of tragedy is a normal human response and not weakness. And this quote is by the Dart Center for Journalism and Trauma. I'll say it again. Distress in the face of tragedy is not a normal human response. Distress in the face of tragedy, is a normal human response and not weakness. This quote speaks directly to the self-care of journalists covering difficult stories, which includes mental health coverage. As Andrew said in his opening remarks, the work that you guys do is very stressful. It can be very traumatic. And so if you don't take care of yourself as journalists, you yourself will be challenged with mental health issues. And so it's incumbent upon you to ensure that you take care of you. And that's where self-care comes in. This quote serves as a crucial reminder for journalists to destigmatize your own emotional reactions to the difficult content that you cover, and to recognize that taking steps for self-care is a sign of humanity, not a professional failure. I'll read that again. This quote serves as a crucial reminder for you journalists to destigmatize your own emotional reactions to the difficult content that you cover, and to recognize that taking steps for self-care is a significant sign of humanity, not professional failure. Having said that, let's look at vicarious trauma. I felt that it would have been remiss of me not to talk or address vicarious trauma, again, given the work that you do. Vicarious trauma really is a type of secondary traumatic stress that results from consistent indirect exposure to a traumatic experience of others. So you are not the primary victim, but because you are covering that traumatic event, and the word consistent is very important there. Over a period of time, you can experience, not just over a period of time, you'll be surprised that you cover one very traumatic event and you yourself might be traumatized by the content of that story that you're covering. It can lead to a shift in your core beliefs and your worldview, similar to the effects of primary trauma. So even though you're not the primary victim, you can experience the same trauma that the person themselves or the story that you're covering of that individual. Vicarious trauma builds up over time with repeated exposure to traumatic material. It can shatter a professional's sense of safety, trust, and optimism about the world and others. Vicarious trauma is a recognized occupational hazard for first responders and healthcare providers. And that includes you too, the media personnel, because of your direct contact with these traumatic events. All right? So remember that vicarious trauma is a recognized occupational hazard. Another term you will hear is secondary traumatic stress. And that is the emotional distress that results from indirect exposure to the traumatic experiences of another person. So you will hear secondary traumatic stress, you will hear vicarious trauma. They are used interchangeably, all right? It is a condition that results from exposure to a single, sudden, or acute traumatic event. So persons who study trauma, the traumatologists, they've kind of made a distinction between secondary traumatic stress vis-a-vis vicarious trauma. So for vicarious trauma, they're more related to consistent, over a period of time, exposure to stress. But they look at secondary traumatic stress as more that single sudden acute traumatic event. All right. Now, there's not much difference between the two. And they, as I said, they're used interchangeably. But the important thing is knowing these terms and being aware that you, as media personnel, being exposed to those traumatic events, you yourself can become victims of post-traumatic stress disorder or acute stress disorder. All right. So again, sometimes secondary traumatic stress is also referred to secondary trauma. All right, so we're talking about self-care. Self-care is any activity that you can do deliberately, and the word deliberately there is very important. It has to be intentional. All right. So any activity that you can do in order to take care of your own mental, emotional, and physical health. So remember, I said that it has to be intentional. Don't tell me like when you walk to work, you're exercising. That is not true. Because guess what? Your mental state is not that of exercising mode. You're trying to get to work on time, you're late, that in itself is stressful. You understand? So it has to be intentional. Good self-care is key to improve mood and reduce anxiety. It's also key to a good relationship with yourself and with others, whether it's at home, whether it's work, whether it's on the block, wherever. Self-care is important where it comes to your interpersonal relationships. Self-care is something that refuels us rather than takes from us. All right. We all need to decompress. All right. And we need to recharge. And that's what self-care is about. Recharging. All right. So journalists and other media personnel face significant stresses, as we've been saying all along. The exposure to traumatic events, the constant deadlines, pressure of breaking news, pressure of breaking bad news. You know, I mean, it's one thing. The sensationalism is one thing. But to break bad news, you know, to persons, it can take a toll on you. And of course, there's the online harassment that I'm sure maybe some of you can speak to that at the end of the presentation. But that was kind of interesting to me that when I was doing the research, that popped up, the online harassment. So another area of concern, we spoke about vicarious trauma, we talk about the secondary stress. We talk about burnout now. Because if the vicarious trauma and the secondary stress is not taken care of, and you do not take care of yourself, then the result is going to be burnout. And that is caused by prolonged stress and emotional exhaustion from an overload of responsibilities and a lack of accomplishment not necessarily tied to trauma exposure. So that is separate from what I just spoke about the exposure to trauma. I'm talking about how do you manage your work life? How do you deal with your stress, the emotional exhaustion, and all of that? So imagine burnout plus vicarious trauma. You're in big trouble. So if you don't practice good self-care and you are experiencing a lot of trauma, you're exposed to trauma, you have that secondary stress, you're going to eventually burn out. And that is not a good thing for anybody. All right? So you certainly don't want to be like this guy. All right? So burnout is really the chronic, generalized emotional and physical exhaustion that results from job-related stressors. And you know, some of that would be high caseloads, administrative demands, lack of resources, and workplace conflict. So, you know, really and truly, guys, the work that you do is already stressful. And so what we're trying to say to you is, it comes with the territory. Your work is stressful. Your work can be traumatic. So all of us, all of you as media personnel, you owe it to yourself. You owe it to each other, you know, to try to make the workplace as conflict-free as possible, as amicable as possible. All right. And then I know that there may be some things that may be out of your control, but in as much as possible, try to make the workplace as amicable as possible, as stress-free as possible, as, you know, reducing conflict as much as you can. Because trust me, I know you are better able to tell me that the work that you do is really stressful and can be traumatic. So you don't want that additional layer of burden on you, because that's just going to end up in burnout. So you really don't want to be like this lady, all right? Being tired all the time, having sleepless nights, aches and pains all over, high anxiety, weight gain, or in some cases, weight loss, inability to keep things straight, anger issues at work and at home and with everybody, and feeling depressed. You know, some of the consequences of burnout, again, would be excessive stress, fatigue, insomnia, whether it's that you have difficulty falling asleep because you have these flashbacks playing over and over again in your head, or you fall asleep and you get up prematurely, you know, and can't fall back asleep. So you're not getting sufficient rest. You get up next day feeling more tired than you go to bed in the night. You get up in the middle of the night looking at the ceiling, and all of those traumatic events, you just having flashbacks, or you fall asleep and you're awakened suddenly with a nightmare. You know, this thing is serious. The work that you do is serious business. And the quicker you realize that, and the quicker you can put mechanisms in place to ensure that you remain well and to guard yourself against that trauma that you are experiencing, then your mental health is going to be compromised. Sadness, anger, and irritability, again, contribute to the consequences of burnout. Alcohol and substance misuse, heart disease, and the NCDs, the other NCDs like the hypertension and the diabetes, you know, and all of these. All right. So please, guys, I can't say it enough. Take care of yourself. If you're not well, then you are not good enough for nothing, for anything. You'll not be able to execute your functions effectively. All right. So please be mindful of vicarious trauma and burnout. So how do we handle burnout? Again, you want to evaluate your options. You want to seek support. And seek support is important, guys. Don't feel like because you seek help, you're weak. As I said earlier on, when we looked at it, you know, the quote that we used earlier when I was getting to self-care. Seeking support, as a matter of fact, on the contrary, it speaks to your strength, your inner strength, not weakness. The person who can find the courage in the face of adversity and seek support and seek help, it speaks to your inner strength. It speaks to your confidence and your self-esteem. All right? There's nothing wrong in seeking help and support. It makes you a better person. It makes you the stronger person. Try a relaxing activity, whatever that is, you know. Let me put a caveat on that. When I say whatever that is, whatever works for you. And it has to be something positive. We spoke about, let me just go back there. I spoke about alcohol and substance misuse. It cannot be a healthy coping mechanism. All right. Exercise, whatever works for you. For me, running works for me. I love running. I'm a distance runner. That's my way of coping. That's my way of just decompressing. You know, running may not be what works for you. You may not be a long distance runner. Maybe swimming is what works for you. Maybe cycling is what works for you. Maybe walking is what works for you. Find what works for you. Get some sleep, and not just some sleep. Get good sleep. I just spoke about insomnia earlier on. All right? Get good sleep. Mindfulness. Mindfulness just being grounded, being grounded in your natural environment, that positive energy, finding that positive energy in your natural environment, those of you who love nature, going a nice, walk, a nature walk, or hiking, or just the beach, just relaxing, whatever works for you. Just find, and be very conscious about your breathing, just life. Just being grateful and thankful for your life, and not just your life, but your quality of life. That there's so many people who would like to do so many things that they cannot, they're just bedridden. Let's be thankful, and let's just be conscious of our life, of being alive, and how we draw energy from our natural environment. Yoga, meditation, all of that, whatever works for you. Just find what works for you. And prioritizing self-care is essential for managing your stress. We spoke about that before. Preventing burnout, mitigating the risk of secondary or vicarious trouble. So basically, that's just a summary of what we spoke about earlier on. So what are some of the self-care strategies that you can take for your mental and emotional well-being? Importantly, you want to be able to shut the job off. Some of you don't know how to do that. Shut the job off. Know how to do that. Create clear physical and mental barrier between the workplace and your home life. Too often, you guys, or not just you, a lot of people, leave the office and carry work home and try to get a story out. I understand in every job that there are deadlines. Sometimes it's almost inevitable that, we have to do that. But it can't be all the time. It can't be often. It has to be once in a while. And we just spoke about your own mental health and self-care and burnout and vicarious trauma and all of that. If you continue carrying work all the time, you're exposed to vicarious trauma, but you have those workloads and you have those deadlines, and it's going to deplete you over time. You're going to be so exhausted that you will eventually experience burnout. And so it's important to unplug. Know when to unplug. Strictly limit or completely cut off consumption of news and social media alerts during non-working hours, especially on your days off. I know it's easier said than done, even for the average individual, outside of you, the media personnel. With these devices that are at our fingertips, the Facebook, the Instagram, and whatnot, some people just can't stay away. It's like an addiction. And so if you don't know how to unplug, you go to bed and you have that blue light in your face, stimulating your brains, preventing you from having that restful sleep that you need for your next day. We have to be able to shut down, and we have to be able to unplug. So let's look at some physical things that we can do, some basics. Mindfulness, I spoke about that earlier on, and movement. Engage in activities that calm the nervous system, such as deep breathing. I spoke about yoga, I spoke about meditation. regular exercise, running, jogging, walking, whatever works for you, as I said before. Make sleep a priority. Sleep has to be a priority. Ensure adequate rest, as exhaustion significantly compounds stress. All right, can't emphasize that enough. Then I want to talk a little about processing and debriefing. Again, I would say seek professional help. There is nothing wrong in seeking help. Seek professional counseling. If I'm going to call upon you to destigmatize mental health, I expect you to lead by examples and to seek professional help when you need it. Don't wait until this thing is about to kill you. When you're in crisis, to reach out to speak to a professional. You know, seek therapy, seek counseling when necessary. There's nothing, it doesn't take nothing, it does not make you a weaker person. If anything, as I said earlier on, it makes you the stronger person. So one who recognizes that at some point we all need that help, you know, especially after covering intense or traumatic stories. Please, guys, I'm asking you, I'm pleading to you, seek help, because I don't want you to be a casualty. Acknowledge your emotions. Recognize that emotional reactions to distressing events are normal and expected. And I'll read that again. Recognize that emotional reactions to distressing events are normal and expected. You are human first. You're a human being. You're an emotional being. Of course, you're going to have reactions. Yes, I can appreciate that. We've experienced that sometimes we build up coping mechanisms that help to mitigate our negative emotional reactions. But at the end of the day, you are human first. Avoid the pressure to get over it quickly. It is quite okay to recognize that you are having an emotional reaction to this distressing event and process it. Allow yourself to process it. And if you feel you need professional help, find professional help and further process it and deal with it, because trust me, if you don't, it will come back to haunt you. It will haunt you. So please, don't hesitate to seek help when necessary. Socialize the problem. Talk about difficult assignments and emotions with trusted colleagues. The word trusted is important there. With trusted partners. Or friends who are comfortable listening. Now be careful. Be careful. We live in a society that likes news. We live in a society that thrives on gossip. I'm saying to you, be very careful. While you want to normalize and socialize the problem, please, you have to be mindful of the boundaries of what you share and when you share it and who you share it with. All right? And you have to be careful that the information that you put out there, you have to be careful of the sensitivity of the information that you're putting out there. And so that's why the word trusted there is crucial, is very important. All right, you can talk to your friends who are comfortable listening, to the story, because not everybody is comfortable listening to these traumatic stories. And you have to be mindful of that also. Trauma left alone can become more dangerous. And I think I've highlighted that before. Watch for warning signs. Be aware of increased irritability, difficulty concentrating, changes in sleep or appetite, and feelings of numbness or anger. All of these are warning signs of stress and burnout or acute stress. These are disorders. All of these symptoms are warning signs. Once you see that's happening, talk to somebody. Talk to a trusted person, a trusted colleague, or seek professional help. Don't let it fester. Debriefing sessions, I'll just speak a little about that. Managers, if you're a manager of a media house, or you're in a leadership position, you want to facilitate and normalize peer support and formal debriefing sessions after hazardous or highly distressing assignments to allow for collective critical reflection and emotional release. This is very, very, very important. I want to talk a little about that. This is not a session for negative criticism. This is not a session to bash anybody. This is a forum for constructive criticism. What did we do that? What is it that we did? What were the strengths? What could we have done better? You know, and even looking at, you know, your emotional reaction to the distressing event that you just covered. You know, it really provides an opportunity to ventilate, to offload, you know, and by sharing, just as we spoke about vicarious trauma, there's also vicarious sharing. So within the organization, within the media house, you guys went out there, covered the scene, and all of you worked on that assignment together, that event, whatever it is, and you will come together at the end of the day, where you all can sit down and talk about it, just vent. And guess what? Somebody in that circle may not feel comfortable sharing, but someone else who share on the same event, they can relate to what the person is sharing and benefit from what the person has just shared. That is vicarious sharing. All right? Benefiting from somebody else's experience. And that is crucial, and something I would really highly recommend that you do in your media houses. Provide that forum, that avenue, that opportunity for persons to be able to debrief on distressing events. Treat self-care as a non-negotiable part of your professional practice. It is as critical as fact-checking or verified sources. Treat self-care as a non-negotiable part of your professional practice. It is as critical as fact-checking or verifying resources. What are some of the organizational responsibilities, having said that? The psychological well-being of your staff through the employee assistance programs that you may have in place. I hope that you all have that in place, some kind of EAP. Provide access to counseling or mental health support services, recognizing the rates of trauma and stress and the psychological impact on staff members. Provide training for staff on signs and symptoms of post-traumatic stress disorder, vicarious trauma, and burnout. Workshops and presentations, seminars, webinars such as this on proactive self-care, stress management, and burnout. And again, I want to commend you know, the president or the leadership team of the Media Association of the Federation who found it necessary to put on this webinar today. This speaks volumes. It's a testament of your commitment, of the well-being of the members of the Media Association and the Federation. And this is commendable. Hats off to you. I want to challenge you. I want to challenge each and every one of you here. I want to challenge each of you to identify one piece of misinformation you've seen in the past and commit to sharing one reliable, fact-based resource in its place this week. I'll read that again. I'm serious about this. I really want to challenge you. Just think of your work. Maybe something that you saw last week. Maybe something you saw 2 weeks ago on the media, some reporting that you questioned it. I want you to challenge yourself to identify that one piece of misinformation that you saw and commit yourself to sharing one reliable, fact-based resource in its place. Let's start the change right here, right now, by becoming conscious creators and advocates for mental health. And I promise that I would share with you a list of some resources in the Federation of St. Kitts and Nevis. On Nevis, we have the Behavioural Health and Wellness Center, which I have the privilege to lead. All right. And that's in Prospect, Cedar Grove. All right. And some of our contact information there, you have it there, 469-5521. That's the government directory. It goes through the government operators. And then we have 6816. And also you could add 6817. That's our extensions. And then we have a direct line, which is 469-5614. And we also have our mobile cell, which is 660-9551. And our email address is behavioral.health@nia.gov.kn.com. This is behavioral.health@nia.gov.kn.com. We also have other resources such as the Nevis Counseling Unit or Care Unit, which is at number 2 East Pringate Building, Government Road, Nevis. And we have the numbers there on the screen. We also have the Alexandria Hospital at Government Road, Charlestown, Nevis, 469-5475. And we have the Charlestown Health Center at the Wards Building, Stony Grove, Charlestown, Nevis. So we have these 4 resource centers or areas or institutions in Nevis. Let's look at the St. Kitts list. We have the National Counseling Center in St. Kitts. That's at Wade's Garden, Baster, St. Kitts, 465-5000. We have the Baster Health Center, Cornell St. Brumier, St. Kitts, 465-2521. Joseph N. Franz General Hospital, again 465-2551. And then we have the Dr. Arthur W. L. Lake Mental Health Day Treatment Center, Limekiln in St. Kitts. My dear friends, it was a pleasure presenting to you. I thank you for your attention. Back to you, Abby.
Wonderful. Thank you so much, Mr. Cuffy, for your presentation. I thought it was very comprehensive and really nice just to explore both how the media can report on mental health issues, but also how the media can take care of their own mental health. Because honestly and truly, your job is tough. You're on the front line, so it's really tough. So we appreciate, both aspects of that presentation. So does anybody have any questions for both Ivy and Mr. Cuffy? Any questions? Any questions?
Yes, I do. Can you hear me?
You're a little distant, but I think we could just about make you out.
Oh, okay. Yeah, because I'm driving actually. So,
Okay.
yeah. Well, first of all, Mr. Cuffy, thank you very much for your presentation. It was a very good presentation, as Abby said, very comprehensive. And I've learned some things from it as well. I have a question. Earlier on in your presentation, you spoke about the study which showed that most of the persons who are suffering from mental health issues, I believe it was on Nevis, were between the ages of 20 to 29. I found that alarming because normally you would think that persons who are more mature or more older would probably be faced with more of mental health issues. So it's a bit alarming for me that, people at such a young age are going through these issues. Is there a particular reason for this? And as you said, even though it was on Nevis, it could also be applied to other parts of the Caribbean as well.
Okay, very good question. Thanks for your question, sir. And so here's what the explanation for that is. If you remember in the stats that I provided, that even before the age, we said that three of the most common mental disorders are substance use disorders, schizophrenia, and depression. The substance use disorder is the culprit. The substance use disorder is the culprit among that age range, ages 20 to 29. And to be honest with you, we can extend that really. If we really have to look at that closely, it will be from 15 to 45 years. 15 to 45 years. This age is at risk. And this is our productive years. And unfortunately, what we have is the comorbidities. So it's not unusual that because the substance use disorders, that you have the schizophrenia and the mood disorders like the depression and the anxiety. And so the culprit is really the substance use, which is, if I were to show you the graph again, when you look at the graph, look at the graph. Substance related and addictive, we're talking about 18.3%. Now, if you have to add that with the depression and the anxiety, 15.9%, 11.4%. All right. What we come to realize is that with the introduction of the synthetic drugs in our society, this is becoming a serious issue. And so that age group, 20 to 29, that's the explanation why we see the highest diagnosed mental health disorders in this cohort, in this group. I hope I answered your question, sir.
Yes, you did. And I have a part two to that question. Would you, and you talk about the synthetic drugs, but I also am curious as to whether marijuana use also plays a role, and especially considering that just a couple of years ago, the government would have, or Parliament rather, would have passed a law amending and decriminalizing marijuana. So it allows a certain, persons to have up to a certain amount in public, and of course, allowing for personal use, so that other persons who don't smoke should not be in the line of the smoke. But does marijuana use play a role, and has there been a significant increase since that legislation was passed?
Okay, so this question is two parts. Let me say that any substance that is considered a psychoactive substance, right? Marijuana included. Psychoactive meaning that there are chemicals in that substance when it reacts to our chemicals in our brain, like our serotonin, or our dopamine and all of that, they will give some negative, or maybe some people might consider it as positive in that it allows them to relax. Yeah, even the medication that we use, that's why we use medication, right? Because when we use it, they are psychoactive drugs. They interact with the chemicals in our brain and they create a certain reaction. Marijuana is a psychoactive drug. So the first part of your question is yes, marijuana would be part of the substance use disorders that we see as one of the substances that we see and presenting in our society. The other part of the question in terms of since the government decriminalized marijuana, has it contributed more or with that problem? I do not have the statistics to verify that. All right, so I cannot speak responsibly on that. I remember last month during Mental Health Week, I was on Von Radio, and and the moderator asked me that same question. But it would be interesting to find out, since the position was taken to decriminalize marijuana in the Federation, if we have seen an increase or in mental health disorders among our young persons or anybody since it has been decriminalized. But I think we would have to it would be interesting to study that, maybe talk to the police and the national drug um, unit to see what the statistics is like, or what it is. But no, I don't have those figures, so I cannot say for sure there is an increase at this point.
Okay, thank you. So any other questions? I see Mr. Bart has turned on his microphone and video. So over to you, Mr. Bart.
Just a quick thing, a quick question. The symptoms of these various disorders, you have, okay, for example, you may have people working under very stressful conditions for very long periods of time, repeatedly seeing things that perhaps are not necessarily things that they should be seeing. And at some point, the break from so-called normal reality occurs, and then you have your various disorders. Now, my question is, for people who are working in an environment where there are other people around doing basically the same kind of work, how do you know, what do you look for when things begin to go wrong? So perhaps you can begin to provide some assistance, some guidance, or take some actions, to take this person out of the environment and that kind of thing. What are the signs, the red flags that one can look for? That's what I'm basically asking.
Okay, good. Good question, Tom. Very good question. All right. So, the good thing about it is that you guys work with each other in your media houses, wherever you are. And so you basically having worked with them for some time, you kind of know them in their normal self. So anything that you find that is unusual about the person's behavior, it could be irritability. I think I spoke about some of that before. I was trying to look at this for the slide. Irritability, agitation, even hypervigilance, just very, very aware of their surroundings, very easily startled, because person who have been exposed to trauma, this is not an unusual behavior where they're easily startled. They hear noise and they jump and they frighten easily. That's what we mean by easily startled. Hypervigilance, always looking around them, it's like almost to the point of being paranoid, These are some of the signs you want to look for. The person has difficulty concentrating, being focused, easily distracted. Yeah. All of these are symptoms that you want to pay attention to, as well as the irritability. If you find that all of a sudden that person now is coming to work under the influence, or you find that the person may be using substances, drinking too much, or whatever influence of whatever substance he or she's using, that might be their way of trying to cope. You find that person, as I said about being very agitated, like, you speak to that individual and the person is just easily upset. This is not, if that's not the person's usual behavior, then you know that something may not be right. So yeah, I think these are some of the symptoms that you want to look at. If you find the person in talking, the person is using narratives, language that is gloomy, depressive, the loss of hope, feel helpless, even speaking about life has no meaning. These are really narratives and language you want to pay attention to and really want to engage the person. And if you don't know how to do it, I say speak to management or try to get the person referred to some kind of professional help. These symptoms should be taken seriously. Does that answer your question?
Yes, it did. Yeah, very much
Okay.
so. All right.
Thank you.
Wonderful. Any more questions? I see Mr. Morris Shaw, I think. Yeah,
Yes, good afternoon, everyone.
good afternoon.
I want to take this opportunity to thank Mr. Andre Huey, not only to invite me to this forum, but to put it together. I think it's very informative, a very good conversation. Thanks to the presenters for their presentation. Though I've been thinking down this line in many ways because I worked in the healthcare system in New York for many years, it kind of bring home a lot of what I have thought about. Mr. Cuffy, I do not know if you have any family in New York, but I know Chris Cuffy from Dominica that plays cricket with me. So,
wow. Interesting.
I just have a few comments and then a question for you.
Sure.
The first thing I would like to highlight, I see Mr. Andrew Huey asked a very pertinent question there about whether or not since the government tried to decriminalize the marijuana, has it created any effect on St. Kitts Nevis? And I don't have an issue with your response as based on what I see you presented. I think you work on the island of Nevis. I would assume that is under the government banner over on that end.
Yes.
So I
Yes.
welcome you. And
Thank you.
I could understand that you cannot come out and present a yes or no unless you have the documents or the data to present of such. But I think as a street journalist, as an individual on the street that is here in St. Kitts, I can speak openly that yes, I observe that since this project started in regards to decriminalize, the people in St. Kitts seems to think it's been legalized. And there's a whole lot of smoking throughout the islands, even though there are laws that is in place that smoking in public is prohibited. But you would find, and you can see the difference in the behavior of a lot of people. So I can say without doing any analytic check that yes, I think that's an issue since this law have come into effect or this process. So I would say that to Mr. Andre Huey, that I think it plays a role in this regard. Another thing I want to say to you is that those documentation that you presented on your slide there is very informative. I would love if you can email me those things. I would like to follow through and present to other individuals based on those facts. Very good information. One thing that from the time this process started this afternoon, and I've been listening to the first presenter and then you, I'm saying to myself, this presentation should have been publicized publicly, because if we want to be honest with ourselves, every individual, including the politicians and this face of St. Kitts Nevis, are journalists. They're on social media, presenting all manner of evil. And when you have a content person as myself and journalists that run a podcast, I mean, I've been harassed on social media on a daily basis by these fake pages and these politicians, because when you present and they put their fake news after you, it's basically attacking your character and stuff like that. So this would be something that really the general public should be hearing, and especially those ministers of government, because that is one of the biggest problems right now we have in a society in St. Kitts and Nevis, where the citizens are reacting fighting amongst themselves, and folks mentally, their mental health is really at stake based on the fake news out there. So I would say to you guys and to Brother Huey that I welcome this presentation to happen again. I don't have a problem carrying it live on my page, but I think this is something I need to go to the general public, not just for journalists, because this is bigger than us. And if few journalists really cannot help this situation, you got to be all hands on deck. So I'm asking you guys to really consider taking this thing national and make everybody be a part of this issue. You know, we are just passing through. The journalist is here. We're going to go eventually. The politician going to go eventually, but around the globe, our people presently and the future of this generation need to really get a hold of it. And believe me, mental health is real. The stress is real. I walk the street daily. People complain to me. People call me. And this is why I made a decision to register with the Media Association of St. Kitts and Nevis, that I can be more involved in educating the people and be that support group. And while I do my part, I present the facts. As you suggested, you have to do your background check. You have to really make sure you're presenting facts. And when those facts are presented, you find people concerned about the numbers of people on the street when you do a protest, or your numbers online that are listening. They're not talking about the issues. The issues are there. And no matter how much you present the issues, they're not even having a conversation on the content. They're having a conversation about your personality. So I do not know if you guys can come up with some kind of presentation in this regard, because we are basically at ground zero with the mental issue here in St. Kitts and Nevis. It's a serious matter. So for now, that's my presentation. I don't want to take up the whole afternoon because there's a lot I can speak about.
Thank you very much, sir, for your contribution. Very good points. I really like the first comment about the distinction between decriminalization and legalization. You're absolutely correct. And I believe some education needs to be done in that regard. That persons of the opinion, because marijuana was decriminalized, that it is now legal. It's not. That's why the police can still arrest you for having a quantity that seemed to be that for distribution. Weren't it for that, you could work with any amount of marijuana that you want. But it's not legalized. It's decriminalized. And the way people walk around this with this thing in the public and just, as you say, smoke up in people's face, and so it's, yeah, it is a cause for concern. In terms of the make it available, I'm sure Abby can, or I don't have any problems with that, Abby. So, you know, I think it's okay for us to share the information with
the
them.
slides and everything we could share. That's fine. If you
sure.
send me your
That's fine.
slides, I can share them, but we'll
Yeah.
also share the recording as well. That's fine.
Sure. And then I think the other suggestion that he made in terms of making the presentation, you know, to the general public, we can have a conversation about that at some point. All right.
I agree.
Thank you very much for sharing. Thank you very much for sharing. Very good points.
Yeah, I agree. I think definitely we should, well, I mean, not overstep, but I think definitely we should do something more general for the public to address some of these issues. And hopefully Andre agrees as well. Maybe we could come together and do something that maybe an in-person event that's live streamed to touch on all of these issues. Because I like what Mr. Marishaw said about, like, we're all journalists in a sense. So many people are doing podcasts, they're doing, you know, organizing events, and they're trying to educate the public, but they might not be informed and they may be misinforming the public. But then we also have certain people that are a little bit controversial. And so again, they probably need to hear the information as well. So maybe it's something that we could try and do maybe early next year or whenever. We can try and organize something so that we can get the information out, so that we can encourage more responsible reporting of some of these issues.
Well, let me take a step forward, and I think the suggestion from Mr. Marishaw is a very good one. Maybe we could look at, and you know, I'm just speaking, you know, as the idea comes. We could probably organize a town hall session at a community center or somewhere. We can live, as you said, live stream it. And that way you would have persons in the audience, they can ask questions. And, you know, it could be something that the Media Association could jointly organize with the organizations here. So that way, you know, this same presentation can be presented to the public and the public will have a chance to engage both online as well as in person. So that's something we could look to do.
All right.
Wonderful.
Good
Thank you,
suggestion.
Andrew.
I think I know Mr. Andre here is always forward thinking, such as myself. So that is the point I was trying to make. Let's get it going. Next year is a long way off.
Okay.
We still have a couple of weeks in this year. Yeah, this is a matter that needs to be done today, not next year. So
let me tell you.
I feel like the year is over because December is like a write-off. Everybody's carnivaling and doing whatever.
Yeah, we still have a few weeks in November.
Okay. Well, let's see what we can do then. We'll speak between ourselves, Ivy, Mr. Cuffy, Andre, and the Media Association, and we'll see what we can organize. If I'm not mistaken, I do believe I see the name of the PS on this call, the PS for Ministry of Health in Nevis on the call. So I'd just like to thank you for joining, if that is you. Thank you for joining. Any other questions? Okay. I did have a question. Sorry, Mr. Cuffy, really quickly. I did have a question.
Of course.
So you mentioned that women, in particular in Nevis, are experiencing PTSD. So I am just wondering what trauma women might have experienced that has led to the PTSD.
All right, good question. So it comes in various forms. You know, the whole issue of gender-based violence is a real issue for us in the region. So that is definitely one of the areas where that's coming from. All right, partner violence and all of that. But also, Abby, you know, a lot of women, or should I say some women, would have experienced stillbirths and you know, spontaneous abortions, you know, and you know, other, you know, maternal and health issues. This can be very traumatic for women, you know, and so when you look at all the directions in which that can come from, yeah, I understand as a mental health professional why post-traumatic stress disorder can be real for women and why the statistics may vary, you know, for the different genders.
Okay, thank you so much. Thank you.
You're welcome.
Okay, any more questions? Doesn't seem like it. So if there are no more questions, then I'll just say a quick thank you to everyone. So a big thank you to Mr. Cuffy for your very informative presentation. Really appreciate it. It was very informative. Thank you, Ivy, as well, for your presentation and just giving us a little bit more information about the project that the Taiwan ICDF is working with the Ministry of Health on. Thank you, Andre, for both your partnership, but also for your welcome remarks. Thank you, everybody, for joining us today. I will just do a quick plug. So we do have a colleague, Organic Wellness. So if you want some practical tips on how you can engage in self-care, they do organize a yoga session every Wednesday at 5:30 and Saturdays at 8:30 a.m. So if you're looking for like a practical ways to manage your mental health and to get involved in some self-care, they have some really good classes on yoga. And Jay is right there. So if you have questions for Jay, feel free to ask her about those sessions. And that's an easy breezy way for you to immediately just take care of your mental health. So Jay, if you want to say something about the yoga sessions, you're very welcome to. And then after that, I can hand over to Andre if you just have any final words, and then we could close out.
Thank you, Abby, and thank you for this very informative session. I'm not feeling too well today, so I didn't speak up much, but I really do appreciate it because what happened is back last September, we did a kind of a podcast where we for Global Week for Action on NCDs. And in that podcast, we interviewed 35 people under 35 doing great things here in Kitts and Nevis. So as a part of that, we wanted to give them a platform to speak. And much of them, I would say, or half of them, one of the main concerns that they had here in the Federation was mental health. And through that, we actually worked with one of our young people with Lake Health and Wellbeing to even have a mental health campaign. So in this, this webinar here, as far as reporting on mental health, it really did impact me because I was the one hosting the podcast and getting the information from the young people for their concerns. So it's really good to hear how we can take care of ourselves, how the resources are here in St. Kitts and Nevis. So as Abby would have mentioned, in Bastille, we do have a studio where we provide wellness, yoga, gentle aerobics, and some movement plans for those that do need guidance with mental health and other well-being issues. So you're welcome to reach out to Lake Health to get information for that. But Wednesdays and Saturdays are the day that we hold our community classes. So thank you again.
Wonderful. Thank you, Jay, for that. And then over to you, Andrew, if you just want to say any final words, and then we'll close out. I think I put Andre on the spot. So Andre, if you have any final words, you could say, or we will just close out.
Yes. Can you hear me? Yes.
Yes, we can hear you.
So yes, again, thanks Abby and Mr. Cuffy and Ivy for facilitating this session. I thought it was very informative, as I said earlier. I've learned quite a few things from it, and I think also all of us as media workers can. There are tools that we can use from the suggestions that were given that we can apply to ourselves. I really think we may need to have a follow-up. And with that follow-up, we can also have more media workers joining us, like I said, from all over, but also to the suggestion of expanding it to the wider public. I think it's also very important to have that as well. And I know Mr. Marshall suggested that we could still try and pull it off before the end of the year. But realistically, I think maybe January might be the best, or sometime next year, maybe even January might be the best time to pull it off. But we'll see. But I think it's something we can look at doing, doing a town hall where we can have it televised, we can have it live streamed, and we can get interactions from people in the audience as well as people online. So certainly that's something that's the next level that we can look forward to. But thanks again for everyone who attended. We've said this the last time, we'll say it again. This will not be the last of this collaboration. We've had, like I said earlier, we had another session earlier with the Disability Association and the media. That was also useful. And we've had some follow-ups from that. And now we have this. So I'm looking forward to the next year and what else that we'll be able to do as a collaboration. But certainly we are grateful for these two opportunities and we look forward to further collaboration.
Wonderful. Thank you. Same here as well. So we look forward to future sessions. I'm hoping next time we'll be able to do something on non-communicable diseases, hopefully sometime early next year. So non-communicable diseases, as you all know, the major health concern in St. Kitts and Nevis. So we'll try and touch on that topic next time. So once again, thank you everybody for joining. Time is well spent. It was very nice to engage with all of you, and we will follow up with a copy of the slides, a copy of the recording, and any resources, in particular, a link to any useful resources that you might find useful in terms of like protecting your own mental health. So thank you so much, everyone, and enjoy the rest of the afternoon.
Hey, guys.